Here we are going to talk about developmental disorder, attention deficit hyperactivity disorder, and autism. So ADHD, a behavioral disorder that is characterized by inappropriate degree of inattention, overactivities, and impulsivities. The childhood problem include the lower intellectual development, some minor physical abnormalities, sleep disturbance, behavioral or emotional disorder, and also difficulty with the social relationship. And early diagnosis is the important to prevent the impaired emotional and psychological development. So the diagnosis is established on basis of self-report, parents and teacher report, and also use of assessment tools. So attention deficit hyperactive disorder, also called ADHD, is a disorder marked by an ongoing pattern of inattention and hyperactivity, impulsivity that is interfere with functional or developmental development. So here we are going to share about the pathophysiology, sign and symptom, diagnostics, treatment, nursing care, and family education. So what are the data we need to diagnose a disease? So ADHD is a psychiatric condition characterized by inattentiveness or hyperactivities or impulsivities. So it is the sign and symptom. So maybe patients' hands or feet, or they always rolling or movement involuntary, easily distracted by external or internal stimuli, difficulty with following thoughts and instruction, poor attention span, shift from one incomplete activity to another, also talk excessively in case of ADHD, shift from one incomplete activity to others, interrupt or intrude on others, engaged in physically dangerous activity without considering the possible consequence. The basic pathology, diffuse abnormalities in the brain can cause cognitive and functional deficit. The other sign symptom we can see easily the distracted, inattentiveness, hyperactive, immature, impulsive, impaired social and academic function. So before intervention, if you ask me how we diagnose it, the clinical assessment or informations from teacher, from parents or primary caregiver, we roll out the other disorder. The treatment basically CNS, central nervous system stimulant, like amphetamine, methylphenidate, or cognitive behavioral therapy. So what are the intervention? Provide parents with information about the disorder and treatment plan. Encourage the support group for parents. Treatment include behavioral therapy or medications, and maintain a consistent environment or appropriate classroom placement. Behavioral therapy focuses on preventing understandable behavior, maintaining a consistent home and classroom environment, and providing environmental and physical safety measures are important. Also promote self-esteem. Stimulant medications may be prescribed. So possible side and adverse effects include appetite suppression, weight loss, nervousness, right? Insomnia, increased blood pressure. We have to monitor every time. So what are the nursing care plan? Monitor child body weight and growth, because patient some medication reduce the appetite and it lead to the stop the growth. So maintain the structure environment is important for them. Also, consistent rules or decrease the distraction. We provide medication with or after the meal. So in the morning, it is good. It is good to give the medication in the morning time to prevent insomnia. Also, classroom teaching academic subject in the morning is good. Provide regular and frequent break. It's help children who have this. So in attention deficit hyperactive disorder, basically it is very difficult in keeping concentration and paying attention in tasks or play activities, and often does not seem to listen when spoken to directly. So it is good to avoid or dislike or irrelevant to engaged in tasks that is require a sustained mental effort. Sometimes fail to give the close attention to details or make the careless mistake. So early distraction or distracted by things going on around them. So sometimes struggle is to follow the thought with instruction. The baby who have this, it is also difficult in organizing the tasks or activities. Also forgetfulness in daily activities. Let me talk about the next one. This is called autism spectrum disorder. So autism spectrum disorder, it is also developmental disorder, and autism is a developmental disorder with symptoms that appear within the first 3 years of life. And its formal diagnostic name is called autism spectrum disorder. Okay, the word spectrum indicate that autism appears in different forms with varying level of severity. Autism, also known as I told you, also known as autism spectrum, but it is a developmental disorder. It is characterized by communication, social, behavioral challenge, and the condition is lifelong and symptom can vary considerable from one person to next. And symptom involve the challenge for varies in individual to individual. So in this PowerPoint, we are going to discuss about some pathophysiology, some risk factor, signs, symptom, diagnostic test, treatment, nursing care plan, and family education. So autism, as I told you, neurological disorder, and that causes behavioral problem or psychological problem. Let me read it. Autism spectrum disorder are complex neurodevelopmental disorder of unknown etiology composed of quality or alternations in social interaction and verbal impairment with repetitive, restricted, and stereotype behavior pattern. So they said underlying cause is unknown, etiology is unknown, related to the genetic factor, some journals said, or environmental factor. What are the risk factor? Risk factor, the family history or sex. It is more common in the male baby. What are the other signs symptoms? So autism spectrum disorder impaired range from mild to severe. Types include autism or Asperger syndrome or Rett syndrome. Symptoms are usually noted by parents by the 3 years of age. So what are the signs symptoms? Maybe impaired social interaction, repetitive behavior, lack of eye-to-eye contact, speech delay, cognitive impairment, or trouble adapting to the routine change. So this said hyperactivities or hysteric behavior, sometimes depressed, sometimes intolerance to the sound, right? Or ignoring the danger, right? So how we diagnose it? We diagnose clinical assessment, rule out underlying neurological assessment, and what about the treatment option? Before to go treatment, let me read it. The cause of disorder is not specifically known. However, it has been linked to a wide range of antepartum, intrapartum, and postpartum condition and exposure to hazard chemicals like genetic predispositions is also linked to the disorder. The disorder is accompanied by intellectual or social behavior deficit, and the child exhibits the very peculiar or bizarre characteristics with social interaction, communication, and behavior. Despite their relatively moderate to severe disability, some children with autism also very excellent in particular areas, such as art, music, memories, mathematics, and perceptual skills, such as puzzling, buildings. Also, diagnosis is established on basis of symptoms and with the use of several scanning tools. So clinical assessment and roll out underlying neurological causes help to diagnose the autism. So what are the data collection? Social and communication. Abnormally lack of comfort and looking for behavior, abnormal or lack of social play, impaired in peer relationship, lack of awareness of existence or feelings of others, abnormal or lack of limitation of others, or communication lack of impaired abnormal speech, such as producing a monotonous voice or echolalia, new word they make, abnormal non-verbal communications, or lack of imaginative play. So also behavioral issues like persistent preoccupations and attachment to objects, range of interest restricted, self-injurious behavior, must maintain the routine, and any environmental change produce marked distress, and it make them very stressful. Produce repetitive body movement such as rocking or head banging. So what are the intervention? So if you ask me about the treatment, unfortunately, no cure. An early intervention services to improve the functioning. The nursing care, we provide referral for speech therapy, occupational therapy, behavioral therapy. So determine the child routine, habit, and preferences. Also maintain consistency as much as possible. Determine specific way in which the child communicate and use of this method. Avoid placing demand on the child. In placement, safety precaution as necessary for self-injury behaviors such as head banging. Assist to initiate referral to special program as required. Provide support to the parents and also ensure a safe environment for the child with autism, right, is the priorities. So we should provide a structural environment or decrease the stimuli, also give notice before implementing change to the routine.